Okay, so thank you very much, Vishnu and Mr. President and all the Rotarians and all the non-Rotarians who are present here tonight. I will start sharing the screen and all you have to do is tell me if you're seeing it.
Yes, we are.
Okay,
Yes.
great. Excellent. So as the topic says, it's about accessing smart healthcare from home. And we have just been through, the pandemic started in March 2020. We are still in the pandemic. We're not too sure. We sometimes think it's going to go away. And then we see some rising numbers. So we are in this sort of up and down with the pandemic. And you would have heard a lot about telehealth during the pandemic, telemedicine. And while that is one part of what we'll be talking about tonight, we're going to be talking about really digital healthcare. So what if you had the ability to be at home during the pandemic and you had COVID and you needed to be monitored by your GP? Do you think that it would have been wise for your GP to come home by you every day and to perform a checkup? Or would you be purchasing the pulse oximeter? Would you be owning a thermometer and doing all of these things and then WhatsApping your doctor, which many persons did? Or are there other ways that this could have been done? And that really takes us into the topic of tonight. And that's really the aspect of digital health. And a digital health service, any service, whether it is a patient connect service or whether there's another platform, and there are many international platforms as well, a digital health service should offer to customers, and those customers are patients as well as healthcare providers. It should offer a virtual suite of services to better manage healthcare from home. It's quite simple. And as you would see, many of these technologies now exist and they are available for use. So why are we talking about digital healthcare? Well, as we mentioned, the pandemic, but quite importantly, even before the pandemic, we had an epidemic. And that epidemic is something that we are all familiar with, for those of you who are medical doctors present today. And if you are a patient who may suffer with a non-communicable disease, you understand what I mean when we say we had an epidemic prior to the pandemic, and we're going to have an epidemic after, because the non-communicable diseases, that still poses a major problem for us, not only in Trinidad and Tobago, but also in the region. We know that from PAHO data, and it's really astonishing that still 62% of people who die in Trinidad and Tobago each year die from a NCD, one or multiple NCDs, non-communicable diseases such as diabetes, high blood pressure, cancer, and so forth. We also know that, and this is another astonishing number, I mean, when you really go down into the research, you'll see that that is more than half of our population. So more than 50% of our population would have at least 3 risk factors for these non-communicable diseases. That is staggering. When you compare that to countries in the Mediterranean, for example, it represents maybe 15%, 20% of their population maximum. But we have over 50%. And of course, persons who would have a non-communicable disease, their productivity, the loss of earnings would be decreased. They have to take time off from work. Maybe they end up in a hospital because of one of the complications of the NCDs. And we could spend a whole night talking about NCDs. So there are many, many complications. We also know that another challenge in our healthcare system due to the NCDs would have been, you're familiar with the term comorbidity. And we know that that accounted for many of the issues and the deaths during COVID. In our country, we have we don't really have virtual care as an established practice, whether it's in the public or private sector. And studies show in other countries, in other jurisdictions, that countries with virtual care, they tend to have better outcomes. So it means that, you know, without virtual care, we also, in our region, we have poorer outcomes because we are not monitoring the diseases as we should. And of course, when you're talking about a circular economy, which is basically, you know, the topic these days, the sustainable economy, how do we go green? How do we decrease the carbon footprint? We still use large amounts of paper in our healthcare system. Globally, 4.4% of the carbon footprint comes from the healthcare sector, and this is mostly paper. So we're still very paper-based in the Caribbean. So a virtual suite, as we spoke about in digital healthcare, it's much more than just telehealth. It's much more than just a video call between a health provider and a patient. It also includes electronic health records. And if we were to do a survey, and we do have people who visit health providers, and the health providers are not just doctors, they are psychologists, they are dietitians, pharmacists, physiotherapists, nurses, anyone who is involved in the business of healthcare. And a vast majority still do not use electronic health records. It's paper-based practices. Patient comes in, you write on your notes, you file it in a cabinet, and you retrieve it accordingly. Sometimes in the public healthcare system, those notes may not be readily accessible, and the patient may be turned away or may have to wait much longer and so forth. So the issue of electronic health records is still something that we have not adopted, not only in Trinidad and Tobago, but the region. But if you look at other countries, you have seen a wide adoption of the electronic health records. And sometimes there's a criticism that it's very cumbersome and it's a lot of headache. It was just better to write the notes, but that has improved dramatically over the years. Then there's something called a patient portal. So a patient portal is where the patient and the provider can interact, or a patient at home has some blood tests, has an x-ray. You don't have to necessarily wait to go back physically to an office. You can upload it from your home. You can ask the lab to email it to you. You can ask the radiographer to send your x-ray digitally, and you can upload this into your patient portal, and then your provider will be able to access it there, and then you can do a telehealth. So that saves you a visit if you just have to review some bloods or an x-ray or so forth. Then we come to the telehealth. We're kind of familiar with this. A telehealth is a video call between the provider and the patient. And this can be done after hours. It can be done on weekends. It can be done on public holidays. And that's a popular one, because think about it, how many times you're at home on a public holiday, even those public holidays that are back to back. And there's some simple things that you need some, maybe it's a pharmacy issue, maybe it's a question for a doctor, and there's no one available. With telehealth, you can access those services after hours, public holidays, and on weekends. And the convenience is it could be done anywhere. You can be visiting family in New York, you could still talk to your doctor in Trinidad. So that's one of the major benefits of telehealth. Now the services are very secure, and I'll show you that later on. And then there's something called health trackers. So digital health has provided now this opportunity. If you are diabetic, you have high blood pressure, and you want to keep this record, normally they'll tell you, keep a record, write it down, come back in 2 weeks, come back in 3 months, 6 months, bring your records with you. Now you can upload your records daily, very, very seamlessly. You just enter your sugar, you enter the blood pressure, you save it, your doctor has access to this as well. So there's no need for keeping those records physically. The health kiosk, that is really for remote areas. Let us say Guaya, maybe the health center, they'll close at 4 o'clock, 7 o'clock, whatever time. But maybe on a weekend, somebody would like to access health services. Why should we just confine health services to the time when a clinic is open? For basic things, for routine questions, you can go up to a health kiosk. You see this in airports and in malls in other countries. And you can actually access health services very securely using a health kiosk. And there are many other benefits of it. Of course, for e-pharmacy, e-lab access, that is always a plus. You don't have to physically go just to go and pick up a prescription or to pick up a request for labs. Your doctor orders a hemoglobin A1C for those who are diabetic. You don't have to physically go in. That can be done through the patient portal. And then we can speak about remote home health monitoring, which is something called the Oximeter Plus. That's available. We used that during the pandemic very successfully. We will talk about that in the next slide. And then there's machine learning. Think about all the data that's collected, but what do we do with the data? If you collect data and you do not analyze the data is really irrelevant. So we can now analyze vast amounts of data in this day and age. We're not waiting for 2025 or 2030. Right now, we use our data in a machine learning program to generate information about the type of patient that is using the service. For example, how many diabetics are using the service? What's the age of them? What's the gender? How many males are diabetic? And let's say South Trinidad. We can access this data using our machine learning protocols. And then, all of this, the whole virtual suite is a good tool we talk about medical tourism. Well, there's also e-medical tourism, and that generates foreign exchange. So that's something that we are using right now. We do chat with persons in the CARICOM and the diaspora, and we're building that platform as well. So this is the Oximeter Plus. It's a simple machine. You put it onto your finger. It's a sensor. It's secured by a Velcro, and you can use this for a wide range of medical issues. It's not just to monitor somebody with pneumonia or COVID. You can use it for sleep apnea. You can use it for monitoring a bedridden patient. And this can be accessed using the internet. So this device connects to the internet at your home, or it comes with a LTE chip. And you can be any part of the world, and you can access a loved one, their vital signs, their temperature, or your physician can do that. So there are many, many uses of the Oximeter Plus. And remote home health monitoring is becoming very, very popular in North America, Europe. And now this technology is also available in Trinidad. And it's something that, we would really like to see, because this is when we talk about better outcomes. This is what we mean by better outcomes. If you monitor someone in real time, that means if something is happening, you can intervene, you can make an intervention. That intervention could be calling an ambulance or telling the patient or their families to take a certain type of medication. So there are the opportunities for intervention, and that means better outcomes. And that is basically what digital health, that is what any sort of healthcare system would want to achieve, better outcomes. So as you can see here, you see the body temperature, the pulse, the oxygen, and these things are updated in every minute. And this can be sent to whoever, and it's very secure because the patient's name is not on it, it's just the module number. So this can be sent to family, relatives, and you have more eyes looking at the screen. Right, so digital health is really going to provide, in the next few years, is going to provide that access, not only from home, where you can use the Oximeter Plus, or you can use the Patient Connects portal to speak to your provider. And that provider, as I said, does not only have to be a doctor, it could be any of the other healthcare providers. But in the years to come, and I think, sooner rather than later, to help the vulnerable communities. And I would really like to see a pilot project. We're just looking at the resources for this project, but to adopt a community and put a kiosk in that community. In those communities, you may have people who may not be tech savvy, they may not have smartphones, they may not have internet connectivity, they should not be denied digital healthcare. That could be done with a kiosk. And these are actually very, very simple. This is not complicated technology. This is technology we currently have. The other use of digital health is at the elder care homes. So the caregiver homes, you can monitor persons there. Let's say those homes have 40, 50 persons. They can all be monitored remotely. So again, real-time access means better intervention. Better intervention means better outcomes. What about patients at hospitals? So you can actually decrease the amount of admissions and an early discharge from a hospital using these devices. Because if a patient is doing well, you want to send, you say, okay, well, spend 2 more days in the hospital, let's see what's going on. What they're doing there, they're really just trying to make sure that the vital signs are good. You can send that patient home with a monitor. They can check the pulse, the oxygen saturation, temperature, and all of these things. So all of these technologies are available and they can be accessed by a health provider. And basically the clients, the customers can be divided up into patients, health providers, and the health ecosystem. So it's not just the doctors and the providers. This information that we're talking about could be readily available to the universities, to PAHO, to the WHO, to our Ministry of Health, to insurance companies. They can use this data for health plans. Patients can be any type of patient, and these health providers could be any type of healthcare setting. It could be a lone GP practice, it could be a hospital, it could be a series of clinics. The reach, how do you reach the clients? Of course, you know, there's media, social media now, the traditional media. We have partnered with many NGOs, and I think Rotary would be a very good partner for us to look at, because we have partnered with the Supermarkets Association, TAP, Diabetes Association, Family Planning, and there are many more, to have free clinics where we expose people to these type of digital health technologies, so that there isn't a sort of stigma attached to it. Oh, I don't know how to use these things, you know, it sounds complicated. These are very, very simple. If you can set up a Gmail account, you can certainly use these technologies. It's really entering a username and a password, and that's it, to access these type of services. So, you know, we can look at a Rotary virtual clinic if you want, because we have done we have done 2 so far with the Supermarket Association. I know Maria is there. She was very, very helpful in setting those up. So that's something that we could look at. And the other customers are the doctor's offices and of course the public health agencies. And all of the services are backed really with customer relationships in mind. And that's by virtual assistants. And we also have product specialists. But any digital health system should really, this is how the modeling has been based in North America and Europe, and it works. The value to the customers, of course, patients, you know, they have a peace of mind. They could do it from their own home. They save money because many telehealth services are at a reduced cost, sometimes as much as 50% less than having to go to a clinic. You can save gas. It's better for the environment. You're not using all this paper. And for the health providers, you know, there's the ease of having everything on your phone or your computer in terms of your appointment schedules and so forth. It's actually, you know, you're going to save a lot of paper. And for healthcare, you're going to get a lot of information. So again, a lot of data is captured from digital health platforms, and that can be used in our healthcare system to really model public health policy. A typical infrastructure for a digital health platform is staff. You know, you need software, you need to host all these services in the cloud, your hardware, IoT sensors, and IT security. So I'll just briefly mention IT security is, of course, the main thing. The question of in digital health and telemedicine, telehealth, how secure is this thing? Could somebody intercept it? Could it be hacked? Well, these security systems nowadays with Amazon Web Services, where all of this is hosted, it's quite robust. It's you know, there's a two-word password. There is the encryption. They have, it's HIPAA compliant. That's a standard for telemedicine. So these systems are very, very robust, and a lot of resources are actually put into security. And obviously, it's for obvious reasons. Who are the partners in a digital health ecosystem? I did make mention of most of these before. Telecom providers, such as B-Mobile, who we work with, Amazon Web Services, and their insurance companies, NGOs, and there's a lot of B2B at the moment. We're discussing with a virtual EAP. I think we are familiar with the employee assistance programs being the traditional way. You have to physically go, but what we have been doing with many companies is really offering them the virtual EAP experience, and that has been very, very successful so far. Right, so I think I've tried to encapsulate the digital health ecosystem, what's before us right now. There are other emerging technologies like augmented and virtual reality. And in the future, that will be used for training, but I could also see some value in it for surgery. We do have robotic surgery in Trinidad and Tobago right now. One of my classmates, Dr. Yadi Singh, he's actually involved in that. And the future is very bright for digital health, and I would certainly entertain any questions you all have.
Thanks very much, Dr. Muradali. If anybody we have a few comments from Camille. I think she was referring to your first slide where she agreed that we are still very much paper-based and cannot track data properly, as paper does not provide a convenient and comprehensive database. Machine learning protocols to do health with big data and for research purposes help you to engage in multivariate analysis. So if anybody has any questions, feel free to post or raise your hand. So we have Della Harry-Paul. Della, you can unmute and ask your question. Thank you.
Hi. Hello. Good night, everyone. Good night, Dr. Muradali. My question has to do with the trackers, the health trackers. I know we have some new things on the market, those that could be used on your wrist. Probably what he's talking about is stuff I don't know about. There's a tracker ring now. How secure is the data? How secure is your information, your health information? Because it's personal information. And I think that is probably something going forward that will be of concern.
Yeah, so very good question, Della. So the question is, privacy, and I did mention that these systems now are being built with a lot of encryption. You probably heard the term blockchain, and that is the next step in ensuring that there's some level of privacy. But if you remember, blockchain is also something that has open source, so it can be accessed publicly. But if you do it internally, then it's really for your systems. But there is a lot of security built into these systems now. You have, if it's those rings you're talking about and the watches, it's basically up to the manufacturer to provide that privacy. Where I sit from the Patient Connect side, we have invested heavily into the two-password authentication, encryption using Amazon Web Services. They have a very, very good system for that, using HIPAA compliancy. So those type of things are really the gold standard when you talk about privacy.
Thanks very much, Dr. Muradali and Ms. Harry-Paul, for that question. Anybody else has any other question for Dr. Muradali? Please feel free to raise your hand or post in the chat. I think you covered everything, Dr. Muradali.
Apparently.
And I know we have some doctors in the audience. especially from the club like Dr. Singh, Dr. Sharma, Dr. Mawa. I don't know if they want to weigh in comments regarding this topic.
Apparently, I answered many of the questions in that slide. Those
So we
slides.
have 2 questions. First one, Camille Cummins.
Okay, hi, good night, everyone. I think because I come from a research background, well, I'm a doctor as well, but I'm philosophy. So, and my background is sociology of health. So I was thinking while we were talking, how useful it would be to access this data. Of course, engaging in all ethical standards and protocols. Would it be easy to apply for permission to get access to a database for research purposes, depending on the study?
Yes, yes, that data that data right now is really data that is held privately. I would love to see the day when our clinics really start to get the data, and they can use machine learning as well, because they will have access to a lot more data. So yeah, but we can have a conversation about that.
Okay, and I just have one more question. Sorry, just, sometimes the questions now come after, in terms of looking at domestic violence victims, right? And I understand this is a lot of biomedical data that you would have, but would you also use this to lodge other types of healthcare issues, such as, okay, a hypertensive patient who's also a domestic violence victim, or who came into the healthcare system because of conditions or subsequent injuries as a result of being a victim? Would that data
Yes.
also be used now?
So, okay, so we do a lot of work with the Trinidad and Tobago Association of Psychologists. And because of that close relationship, we do have a lot of clients using the service. And that the clients who use the service, what tends to happen is that the psychologists on that side would really utilize the electronic health records to keep their records. And once we have the access to that data could be used again in machine learning. So it can be used for that purpose. We have not used it as yet. We're more focusing on the NCDs at this point in time, and trying to get more data so we could do a better analysis. But yes, I mean, it can work for any group. It can work for psychologists, it can work for the dietitians, it can work for pharmacists. As I said, once you have good data, you can do data analytics.
Thanks very much, Dr. Muradali. We have another question from Dalla Harry-Paul. Go ahead, Dalla.
Hi, thanks for that first answer for the first question. What I wanted to know is how far along are we in terms of this revolution, so to speak, in terms of healthcare locally? I mean, are we tapped into what is out there internationally? I know COVID would have raised our awareness as to the possibilities of all the things we can do online and remotely now. So yeah, that's just it. Where are we locally?
So it is an emerging space. And one of the things in digital health that has been in the public domain for some time is really the telemedicine. But all the other things mentioned, patient portals, electronic health records, that's all available right now. Everything I spoke about, that is now available in Trinidad and Tobago. The issue is just really scaling up. The issue is, getting it out there, working with providers, trying to educate patients. And I think we spend a lot of time trying to, like in this forum, for example, trying to educate persons what is available and what is not available. And if it is available, what is the easiest way to get it into the hands of persons who wish to use it.
Thanks for that question, Della. And do you have
Does
another question, Della?
No, they just had like maybe part two. Where do we access this information?
Okay, so I mean, I can leave a link. It's patientconnect.com. Very, very simple. The connect is 2 T's though. So it's patientconnect.com. And you can go and you can look at the easy ways to access various services. And just try out the system. One of the best things, especially health providers, almost every day I have conversations with health providers, and there is a lot of stigma attached with digital health. We have been in practice for 40 years, 50 years, all paper-based. This is going to take a lot of doing, and it's actually not. You can start fresh if you don't want to go back into your old records. All you need is a smart device in your office. It could be a phone, it could be a laptop, internet connectivity, and that's it. And there are many, many things that you could do to really boost your practice as a provider. And it does benefit the patient tremendously. So, I'm happy to be part of that technology. It's something that I adopted early during the pandemic, and we just try to build on the system, work with some international players. But surprisingly, the majority of what we do has been created locally. We have a local inventor for the Oximeter Plus, the remote home health monitoring device. And we also, a lot of technology, the IT backbone, it has been done locally as well. And we connect everything to Amazon Web Services for the security. So, it's really, a very, very, it's local content.
Thank you. And we have another question from Charlene Toluca. Go ahead, Charlene.
Hi, good evening, everyone. Thank you for this very informative session, Dr. Muradali. I just wanted to know how on board are the insurance companies with this, with the digital health service from your experience so far?
All of them have signed up. So I know we do work with the Sagicor, Guardian, Maritime, Beacon, all of them. They all offered certain services during the pandemic, and I know that those continue. So people who use the service can make claims as they would do if they were in a brick and mortar setting. So yeah, the insurance companies have adopted digital healthcare. It's one of the first things they did during the pandemic, and I'm very happy to know that.
Okay, and one more question. From your personal experience using the system with Oximeter Plus, I saw something on your slide saying you've got 32 providers using the system with over 1,000 patients. Is that current?
No, that's actually, it needs to be updated. There are over 60 providers.
Right.
And I can't tell you, the patients increase every day because every day we do work with certain companies and they may onboard 500 at a time. So, so that number changes. But the important thing is that we continue to learn as well. As we scale up, there are greater demands and we also on this learning curve. So we could offer better services to persons who wish to use it.
Thank you very much. This sounds very exciting, and I look forward to hearing a lot more about it.
Great.
Thanks very much, Ms. Toluca. We have one comment from Jeremy Sean. In order for this to work smoothly, we need the hospitals and doctors and medical clinics on board for data to be used properly. So it's what you had answered a little while ago. Do you have any, is anybody else have any other questions? And I think we've been getting some good questions with regards to your presentation. Well, if no one else has any questions, I would like to call on Secretary Vanood to do the vote of thanks. And thanks again, Dr. Muradali.
Thank you.
Sure. Thanks, AJ Maria. Quite simply, I mean, Dr. Mural, you've shared with us quite a lot of information this evening that's quite helpful and could have some real potential to assist us in many ways, particularly our elderly parents like mine. So we certainly appreciate your time this evening for sharing this information. You've put the website as well as your email address in the chat, so we have some takeaways to review, and perhaps you'll be seeing some emails in the coming days. So on behalf of the Rotary Club of St. Augustine, we extend our heartfelt thanks to you for the time you've taken this evening to provide this information, and we certainly appreciate it very much. Also to the attendees, a lot of whom are actually not Rotarians from what we've seen. We certainly appreciate you logging on and joining us, and thank you for taking the time. Do enjoy the rest of the evening.
Thank you. Take care,
Thank
everyone.
you. Have a good evening, everyone.
Bye.
Thanks. Bye-bye.